I'm Jenna Henry, and this is my son,
Dallin Henry.
and I'm going to be doing a head-to-toe assessment on him. Dallin, tell him how old you are.
12.
Okay. Tell me what the year is.
2020.
Okay. What month are we in?
August.
What day of the week is it?
Thursday.
Who is our president?
Donald J. Trump.
Okay. According to your height and weight on the BMI scale, you are a little bit just over the borderline of being normal, as in a little overweight. What kind of foods do you enjoy?
All kinds.
Okay. Posture, you're sitting erect. I see no obvious physical deformities. Your gait was steady when you walked in with no devices used. How is your mood? How are you feeling today?
Good.
Okay. Mood and his affect are both the same. Speech is clear and personal hygiene is good.
This is the assessment on the 12-year-old boy, the head to toe. He was alert and oriented ×3. He was well nourished. His BMI was a little bit above normal, which was sliding over into the overweight, but he was right there, the 26%. He had good posture. He was sitting erect. There was no physical deformities visible. When he walked in the room, he had no assisted devices. He ambulated. His gait was steady. He was in a good mood. He admitted that his mood was good, and the affect matched his mood. He also had good hygiene, and he had no complaints. During the head-to-toe assessment, I assessed his skin. It was warm, dry, intact with no lesions. He had good skin turgor. I checked his scalp. There were no lesions. There was no dandruff. There was no infestation. His hair was nice and clean, nice and thick, dark brown, with it was nice and full, thick, and he had no alopecia spots or anything. Checked his cranial nerve 7 of his face. It was intact. His temporal arteries was symmetrical with no edema, and there was no tenderness upon palpation. The TMJ, the cranial nerve 5, was intact. There was no pain or no tenderness upon palpation, and I assessed his maxillary and facial frontal sinuses, and there was no pain and no tenderness upon palpation. The eyes, I assessed the cranial nerve 2, which was intact. He was able to read a sample for me. I also checked his cardinal fields of 3, 4, and 6 as I did the field test, and he was able to follow without moving his head. I also checked the exterior of his eyes. There was no drainage. The conjunctiva was pink. The sclera was white, and the iris was dark brown. His pupil dilation was equal and bilateral when I assessed for the dilation. I also checked, moving from his eyes, went to his nose. The external had no lesions. His bilateral nostrils were patent. The septum was midline, and I tested for the cranial nerve 1, which was intact. He was able to smell the scent that I provided, which was actually vanilla. His lips and buccal mucosa was nice and moist. His teeth were nice and white, straight with no obvious cracks, no pains, and no obvious cavities or missing teeth. His gums were healthy. His tongue was intact. It was checked for the cranial nerve 12. His tonsils were not enlarged. There was no exudate and no inflammation. The vulva had the cranial nerve 9 and 10 intact, and the thyroid gland was not enlarged. Moving to his ears, checking the external, there was no lesions, no bruising. His skin looked nice and healthy. There was no tenderness during palpation, and I was able to assess the cranial nerve 8, and the test, his hearing was adequate. I assessed his neck. It was symmetrical. There were no lumps, no pulsations visible. The lymph nodes were non-palpable. They were non-tender upon palpation. The carotid artery was assessed one at a time, and there was no bruits noted. And he did active range of motion with his neck and had no pain, no tenderness, and was able to do full range of motion with his neck. I did the cranial nerve 9, the muscle strength, and he was able to push against resistance and had good muscle strength intact. Assessing his hands, his nails were nice and clean. Capillary refill was less than 2 seconds bilaterally on both hands. His peripheral pulses were symmetrical, bilateral 2+. I assessed his lung fields, inspected palpate. He was negative for CVA tenderness. Listened to his heart. There was listen to the apical pulse, which is located in the mid-clavicular on the left side, the 5th intercostal space. The pulse was regular. No abnormal, no irregular beats noted. The S1 and S2 was sharp, and there were no S3s or S4s heard, no murmurs, no extra beats noted. Assessing his abdomen, it was soft, non-distended. His vowel sounds were hyperactive in all 4 quadrants. There was no pain or tenderness upon palpation. I did some light and some deep palpations, and there was no tenderness on either exam. Assessing his lower extremities, his bilateral lower extremities were bilateral symmetrical. The hair distribution was bilateral. There was no uneven. It was normal for a boy his age. I was able to test his pulses, his femoral, his popliteal, the posterior tibia, and the dorsus peta, and all were present, 2+. There was no edema. his lower extremities. He was able to do full range of motion with no crepidations, no pain, no problems. His muscle strength was good and bilaterally symmetrical. His upper extremities, I was able to do full range of motion. There were no crepidations on the upper extremities either. He was able to do full range of motion with no problems, no complaints of pain. On the muscle strength, the cranial nerve 11 was intact. We did the test of the cerebellum, the heel to shin, and the Romberg and the patellar reflexes, and there were no abnormal findings. All came back normal. The scoliosis screening was negative as well.